I found it quite an interesting approach to feedback and assessment, because very often summative assessment stops there. It's a conversation between, you're hoping it's a conversation between the person who's marked that assignment, who gives them feedback, and you're hoping they're understanding the feedback. But actually often you don't have much evidence whether they have or not, and also nobody else sees what they've done, and that seems... So I think it's an interesting approach you've used.
Well, it's a piece of work that you hope is not just something that's finite and forgotten about after year one, that actually you've taught them these 4 key skills for evidence-based medicine, and that they can then, a few weeks later, start to see how they can use them in terms of communicating with their peers, that they can use it in PBL, for instance, perhaps get out of bad habits like looking up information on Wikipedia, for example, or just a Google search, that they're learning how to use reputable and accepted quality medical databases, and that when, for instance, they move into second year and then clinical practice, and they're having to or just raising queries in their own minds as they study and see patients, that they'll know where to go to find evidence, and also how to formulate a question appropriately, and then to be able to share it thereafter.
Okay, so that's just one aspect of feedback and assessment on the course. Interested in, perhaps you could talk a little bit about the way that assessment and feedback are used more generally on the course. Okay. I mean, is that typical of the approach you use?
What I'd like to think is that at the end of our clinical skills teaching, after a year, 18 months, that we've taught our students to have a kind of healthy skepticism about what they've been told, that we ask them to accept what we're teaching them, but also to be prepared to question it, to ask us why, and not just to say, not just to accept that that's the way things have always been done. And then we try to be very proactive in getting them to feedback to one another, so that there's a lot of peer feedback and trying to promote a lot of reflection. We have 4 strands within the course. So there's physical examination, there's history taking, there's communication skills, and then there's professionalism. And in each of our sessions, we try to illustrate to them how each of those strands is going to emerge in the session. So for instance, if you look at a workbook entry, for instance, in respiratory examination, you'll find a set of professional values that we'll highlight to them, things like a proper approach to the patient, taking consent, of infection control, etc. We ask that when they attend the sessions, they always attend in NHS dress code. So there's the idea that when they come into the skills centre, they're entering a clinical environment, and we hope that this is good preparation for when they subsequently go on to the wards, and when they're already going into clinical practice in a GP surgery. And then we will have, within that kind of framework, we'll have some dedicated sessions where we're concentrating perhaps on communication skills or bedside teaching, and we'll use observation guides, so that one student will perhaps interview a patient simulator or interview a real patient, while the others use the observation guide to make some notes, and then at the end of the interview they can provide some feedback to the student who's been interviewing. And so that hopefully the culture is that the student interviewing is interviewing on behalf of the group, and it's a group exercise where they're learning together, giving feedback, taking feedback. In the case of simulated patient simulators, there's then the opportunity, having taken the feedback, to perhaps rerun an aspect of the consultation interview that they've been undertaking. So there's a chance to rehearse, and we try to emphasise, that this is the place before they get onto the wards or into clinical practice where you can make your mistakes and learn strategies as how best to communicate with patients, and the process of an interview. And then when we have patients in for bedside teaching, we can illustrate, using a different observation guide, the content of what they need to gather in terms of a good detailed medical history.